Right, good morning everyone. I'm Paul Iggulden, consultant in the Public Health Dorset team. I've got 10 minutes or so just to tell you a little bit about how Public Health Dorset fits in the local system and share some thoughts around prevention and creativity.
I'm just going to move this up for you because otherwise the camera won't be able to hear you on the audio.
Can you hear me at the back okay though? Thank you. So share some thoughts a bit about actually what I'm looking for from today around prevention and creativity, and something for me around looking at examples and where we might go further, faster around involving communities with and through the arts. Aha. And then I turn into Michael. So now I'm back to Paul. Here I am. Yes, though I was getting used to being pink, but anyway. It's okay. Public Health Dorset. I'm going to talk a little bit about the sort of central government funding that supports, or what's supported by the central government funding around public health in Dorset. But of course, there's a lot more. I'd almost refer to that as like the formal arrangement, but a lot of public health good work operates with and through other partners, and in particular in our communities. So the central funding is a part of the picture, and sometimes we can use that central funding to help support and stimulate other partners to do good work in promoting health and well-being. I'll carry on. So Public Health Dorset, it was formed a while back before I joined, 2012 I think, or thereabouts. At the moment, public health is funded through central government with grants being awarded to local authorities. So upper tier local authorities receive a public health grant. In the Dorset context, we have two local authorities, Bournemouth, Christchurch and Poole and Dorset. They each receive a public health grant. It was decided locally to sort of pool that resource together to create a shared service across the two council areas. That shared service is Public Health Dorset. As part of the grant award, there are clear requirements of how that money should be spent, and a number of commissioned services and a number of directly provided services. I'll just pause there, see if we've got slides back. No.
Sorry. Are you right for us to just have your name on there? If you come back onto the screen on your desktop,
Please do talk amongst yourselves for a moment and we try to fix this, and then we'll get back on track in a moment. I don't want you to not have what you've got.
Sorry about that.
Yeah, could you take the next couple of minutes, maybe introduce yourself to the person next to you and discuss what you think are the main public health challenges in Dorset. Are we back? And it's the down button, is it? Okay. We're back with slides. Okay, so public health, this is a definition from the Faculty of Public Health, the science and art of preventing disease, prolonging life and promoting health through our organised efforts. So I've talked a little bit to this slide, but just to highlight the four sort of main areas of our public health focus work: supporting healthcare, public health, health improvement, healthy places and health protection. I'll just say a little bit more about those four areas. Healthcare, public health, strong emphasis there locally for us around reducing health inequalities that arise in the healthcare context. The top right, health improvement, there's a lot of our commissioned work goes in there. So our grant is used to commission a range of public health services, sexual health services, schools, nursing services, drug, alcohol treatment services. That consumes a very large proportion of the grant budget that we have. We also locally have what is now in effect our in-house health promotion service, which some of you I hope have heard of. Who's heard of Live Well Dorset? Yay! Thank you. So that's our kind of direct provided health promotion service, looking particularly at behaviour change. Bottom left, healthy places. That's where we're looking to influence and work with partners around what we refer to as the wider determinants of health. And then there's the final quarter there on the bottom right, work that we do around ensuring that everyone stays safe as possible, around health protection. And clearly we were very busy during COVID, with that quarter really filling the whole of the screen. Yeah, I joined Public Health Dorset in February 2020. It was an interesting time to join. I joined to focus primarily on the Joint Strategic Needs Assessment, but I didn't really get to do very much of that. So, I wanted to say a little bit about kind of my lens and what I'm hoping to see and hear and get ideas around today. Ash talked a lot about healthcare settings and arts, and I'm sure we'll hear more of that later today. I guess my passion and enthusiasm is around prevention, and in particular the idea of getting, we talk about getting upstream, prevention being better than cure. And we face a world where there are arguably a whole range of different public health challenges that we face. One that I'll be carrying sort of through with me today. Well, actually, no, I hope I won't be too lonely today. But loneliness is a key challenge that we face, which, as the slide refers to, it's been calculated that it's as bad for you as smoking 15 cigarettes a day. So loneliness is one of those underpinning things that we really need to strive to do more about to enable people to live full and healthy, fulfilled lives. One in which I think we'll all acknowledge that creativity plays a massive part and can help us with addressing. So, the kind of lens that I'd like to encourage us to think a bit about today, and you might want to use the 5 ways to well-being as a bit of a lens for how we think about what needs people have and how they might best be addressed and supported through creative processes. So the 5 ways to well-being was commissioned in effect by Gordon Brown. The New Economics Foundation did a massive research piece into how well-being can be supported and promoted. And they came up with these 5 ways to well-being, which took me ages to work out a way of remembering these. Clang is the way I remember them. Connect, learn, be active, notice the world around you and give. It's a nice way of remembering them. Some of us of a certain age might remember that great TV show, The Clangers, and others have suggested that we could add to clang and add in considerations around eating, relaxation and sleep. So we could have a clangers. 5 or perhaps 8 ways to well-being. Joking aside, the 5 ways to well-being, a powerful model, I think, and it's, touch points there for the creative process. Many of the things we'll hear about later today will embrace 2, 3, 4, maybe all 5 of those 5 ways to well-being. Alongside my day job, I have a role in a charity. I chair West Howe Community Enterprises, and we use 5 ways to well-being as a kind of lens for how we think about the projects we're going to try and engage people to work on, and a framework for how we evaluate. So that's a model I'd welcome, I certainly will be looking at today through the lens of 5 ways to well-being. And I guess I just wanted to leave you with these 2 questions, ones which I'll be sort of bearing in mind as we go through today. How does creative health help us with the prevention agenda, and how will it help us tackle health inequalities? And that's me. Look forward to talking with you through the day and hearing the wonderful work that's going on in Dorset.